The second potential concern that we have regarding corticosteroids is elevation of eye pressure, which leads to glaucoma. By definition, glaucoma is a disease where the pressures of the eye can become elevated and leads to progressive injury to the optic nerve. And there have been multiple studies looking at the effects of steroids on eye pressure, and 30 to 40% of all patients on systemic corticosteroids will have an elevation of eye pressure within 3 to 6 weeks after initiation of treatment. Some of the risk factors that may influence the development of this eye pressure elevation can include patients who are high myopes. In other words, if your correction for your glasses is -6 or greater, you might be at higher risk of developing this pressure response. Patients who are diabetic, patients who've had a history of glaucoma before exposure to steroids, those who are younger in age, so the pediatric population who are exposed to steroids may have a greater response in this manner. The potency of the steroids and the duration of time that one is on steroids will all influence the potential to develop this. And similarly, the route of administration, as I mentioned earlier with cataract development, if one were to inject a steroid around the eye and you have more focal concentration of steroids in those areas, you may have a greater risk of developing elevation of eye pressures, just as you have a greater risk of developing cataract.